Hypertension, also called high blood pressure, is blood pressure that is higher than normal. One's blood pressure changes throughout the day based on activities. Having blood pressure measures constantly above normal may result in a diagnosis of high blood pressure or hypertension. World Hypertension Day was observed on May 17th. Under the theme, measure your blood pressure correctly, control it, and live longer. Medical professionals are spotting a worrying trend among the younger population. Dr. Sonia Nixon warns that if certain habits are curbed during early childhood, some of the lifestyle diseases experienced later on in life can be prevented.
Even younger populations or young children are having elevated blood pressure because of we've had so much change in our lifestyle, right? We see a younger population having very elevated pressure. The earlier and the longer you have that kind of trauma on your heart, on your head, on your heart, that kind of pressure is the more you're likely to have a problem, the more you're likely to have injury, right? So you want to make sure that you start checking early. And they're saying that from your 18 years old, you should actually check your pressure twice a year. From your 18.
Nixon explains what can happen if one's blood pressure is not properly controlled.
Continuously heavy, right? It will break up, it will damage your heart. Okay, your heart is not going to be able to function. So think of your heart as a treatment plant where it comes in and it distributes to everywhere else. 2, if when the pressure on the pipe is high, sometimes your pipe in your house bursts, right?
Mm-hmm.
Because of that same elevated pressure. So you can have other damage in other places, right? Especially in your heart. Or in the brain, you can have strokes. That's what a stroke is, basically bleeding into the brain.
Right.
Or either bleeding, which causes disruption of function, or sometimes you get a clot in the brain that causes disruption of function beyond the brain.
He highlights the accepted range one's blood pressure should be at.
120/80 is what is accepted as maximum. If it starts going up, you worry. Between 80, the diastolic, the bottom pressure, goes between 80 and 90, so it's elevated. Once it gets to 90, you have hypertension. Okay, you have high blood pressure. No.
Here are some of the factors that contribute to hypertension.
But what if your mother has high blood pressure? What if your sister has high blood pressure? What if you work in a job that's kind of stressful, right? What if you're Black? What if you live within a certain socioeconomic range? People who are not necessarily wealthy, right? What if you're overweight or obese? What if you're physically inactive? What if you smoke?
There are a few symptoms of severe high blood pressure. These range from severe headaches, nosebleeds, fatigue, vision problems, chest pains, difficulty breathing, irregular heartbeat, and blood in one's urine. Christelina John, GBN News.